Hi everyone, my name is Mike Bryan and I'm happy to have here today Becky Joseph, who's the Community Education and Engagement Coordinator with Interim Healthcare, and Tracey Rector, Volunteer Coordinator with Interim Healthcare Hospice. Both of you are with Hospice, and we've already interviewed the other side of Hospice, the home healthcare part, with Mary Beth Lemon several months ago, and again, I'm glad to have you guys here to do this now.
Happy to be here.
Well, one of the first things we want to find out is where are you located? So what's the address?
Our address is 2809 Bell Street and Suite D of that building.
Okay. And what's the best phone number?
It would be 740-453-1173.
And an email address for you and Tracey for you?
Mine is rxjoseph@interim-health.com.
And mine is Rector@interim-health.com.
Okay. And if anyone has questions, they can email you, both of you.
Absolutely.
Directly.
Absolutely.
Okay. And the website, I understand, is interimhealthcare.com, and then they can scroll down and find various services that are available.
Yeah.
And I was also able to notice there's a Facebook link, a link to LinkedIn, Twitter, etc. There's a contact us form and a blog, and there's a lot of good information that I could see on there that is available to the public. So one of the first questions folks might have is, what do each of you do? So as community education and engagement, can you kind of explain what it is you do?
Sure. Hospice is such a misunderstood level of service in the healthcare continuum. And so I try to get out among the community in various settings to explain what hospice is and isn't. There's so many myths out there about what hospice is, and unfortunately many people don't access hospice in a timely fashion, and they miss out on the benefits of that service. So I try to take that information to as broad of an audience as I can. That's the education part. Also, I do some education on advanced directives, healthcare power of attorneys, and living wills, encouraging people to have those completed and the reasons why we need to do that, along with the myths and facts about hospice. And as far as engaging in the community, it's good to network and get to know some of the other professionals, just like you're doing here today, sharing with the community all of the options that are available for them as they navigate healthcare. So I belong to the Zanesville Rotary of Daybreak. I also belong to the Muskingum County Task Force and to the Veterans Appreciation Foundation. So trying to engage myself and who I represent in some of those agencies to further our mission.
Okay. Well, and Tracey, what about you as volunteer coordinator?
Well, Medicare actually requires all hospices in the United States to have a volunteer program. They feel very strongly that it not only adds to the team's approach for wraparound care, so to speak, but it's also really a good way to take people's talents and give them that one-on-one attention, so in addition to what our caregivers do. So my job is to also recruit. So we're looking for people that are interested in those opportunities, and then get them trained and ready to go through that process, and then finally match. So we want to look at the talents of the volunteer, their interest, their availability, and their geographic location, and then match them to the patient that would be best suited for them.
Okay.
And so not every patient wants nor needs a volunteer, but it's something that we want to offer to just complement the team services.
And so if someone's interested in being a volunteer, they just reach out to you directly and...
Absolutely. It is definitely a little bit of a process, because, and you can understand, we're sending people in to private homes in a vulnerable population. And so we need to have some checks and balances for our volunteers. So we do things like drug testing and a background check. We require a 2-step tuberculosis test. And all of this is no cost to the volunteer.
Okay.
So we get through those processes. There's an application and some paperwork we do, and then we have a training program. The training program can be modified to different individuals' needs, because some folks are really, really comfortable with the internet-based modules, online learning, and that's a fabulous way to do it. But some people would rather have face-to-face, and I can take the show on the road, so to speak. I can go to them We recently did one where we had a group of individuals at a church that wanted to train together. So I packed my stuff and we went to them, and it worked out great. So everyone's needs are different, and we try to tailor that.
Oh, that's nice. Well, that's just a nice opportunity for volunteers. That's a nice outlet for that, for sure. Well, one of the questions I get all the time is, as soon as you hear hospice, you think, oh my gosh, someone only has a few days to live, and I know that's not true, but tell us about that. Why is that not true? Either one of you.
Well, that is the number one myth. You're
Yeah,
correct. Hospice actually is a philosophy of care. It was the brainchild, if you will, of Dr. Dame Cicely Saunders way back in the early 70s in the UK. And it came over to the Western world probably in the late 70s, early 80s. And in the late 80s, Medicare recognized the efficacy of this level of care and providing comfort and symptom management for people that were facing end of life or terminal illnesses. And they actually made it a Medicare benefit. So it's a philosophy of care that focuses holistically on a patient. We look at a person as a human being, mind, body, spirit, emotion, and all of the loved ones and families that are attached to that human being. And they need to qualify for Medicare using the hospice benefit with a life-limiting diagnosis. And it says that 6 months or less if nature were to take its course. Now, we don't come with expiration dates. So that is just a regulation. So the 6 months or less is what you need to qualify. If nature were to take its course, your physician would not be surprised if you could succumb to that disease or condition. However, the Medicare benefit is a lifetime benefit, and it's administered in certification periods that are 90 days, 90 days, and then 60 days thereafter for your lifetime.
Okay. And I know I've had clients myself. I know they've been on hospice and they were taken off hospice and maybe they were back on, so you can rotate in and out, is my understanding. So, when someone is on hospice, and you actually, when you spoke at Rotary a few years ago, it seemed as though that if they got involved with hospice earlier and they got that myth out of their mind that means that someone's going to die almost immediately, they actually in some cases have a longer lifespan, or at least more comfortable during that time frame.
Absolutely. There is actually evidence-based research that shows, and this I think was done in the population of lung cancer and pulmonary diseases, that patients that accessed the hospice benefit earlier in their disease process did have a longer life expectancy than those that did not. And I think that's because they have that relief of anxiety with respect to, we are available to them 24 hours, 7 days a week. We become the eyes and ears of their physician. We have nurses visiting in their homes. We're approaching their care holistically with pastoral services, with volunteer services, as Tracey mentioned, managing their medications, being there to see early onset of exacerbations of different kinds of symptoms, managing pain and anxiety, managing depression and sleeplessness, all of those things that people try to do on their own, where when they have that resource available and they have that access to a 24/7 nurse to talk them through something or to manage whatever might be going on, it takes away a burden from that family and from the patient that then plays out into the quality of their life being improved.
Sure. Well, and again, quite a bit of services there that are provided through hospice. I don't think a lot of folks know that is even available.
And Mike, it kind of goes back to your point about when you talk to people about hospice, because along with Becky, I'm doing a lot of education more than anything, getting past some of those myths and misunderstandings. And so when you say hospice to someone, their mind goes to the patient that's in bed, may or may not be responsive, last few days of life. And so getting people to understand that, yes, our culture has not historically liked to talk about death and prepare for death, and we tend to shy away from those things. But the good news, I think more and more people are enrolling in hospice earlier into their disease process so that they can take advantage. And so, on the volunteer spectrum, getting past that, well, how do I help someone who they're getting ready to die. I don't know that, how can I help?
Yeah.
They're like you and I. They might be ill, but they still have interests and passions and things that they want to do. And if nothing else, they need a distraction from their worries. And so the typical hospice patient that people think about is not always the case. And so
Right.
I think more and more, you know, especially at our office, we're seeing people that are joining earlier, and that's a good thing. Getting past that feeling of, well, if I say I'm going to do hospice, that means I'm giving up. That means I'm done. I'm not going to do anything else. And that's not necessarily the case. It's just taking a different course on how you want to manage your health.
So if someone has they've gotten past that fear of, I don't want to be involved in hospice, how do they initiate the process? I mean, you mentioned earlier that their doctor would have to have the life-limiting diagnosis, but how do they start the process? Do they make a phone
Anyone
call?
can make a referral. Anybody can make a referral. All they need to do is call our office, and we can come out and do an informational meeting with them. We can come out and sit down and explain the entire hospice philosophy and program to them, go through what it is and what it isn't, ask them what their particular goals are, let them see what it might look like for them if we would come and partner with them in their healthcare journey. And then it's our responsibility to reach out to their physician to get the medical records with their permission, obviously, and work through that to find out, are they eligible to access, in fact, their hospice benefit or their Medicaid benefit or their private insurance benefit. Most hospices are covered by private insurances. Not everybody is obviously Medicare eligible if you're under the age of 65. So private insurances do cover hospice, and the same process would go through.